Hello, my name is Dr. Delia Jones, and today we are going to talk about skin cancers of the feet. Skin cancer is often not thought about when one considers the foot. However, skin cancers can occur anywhere in the body. Overall, one should know that skin cancers have several features in common. The majority of these lesions are painless, and oftentimes patients will complain of cracking, bleeding, or ulceration. Patients will discover the skin cancer after an unrelated ailment occurs somewhere near the area. When one thinks of skin cancer, typically one thinks of sun rays. So you think that because of the harmful sun rays that this is why you get skin cancer. However, when you talk about the foot, oftentimes the foot doesn't get a lot of exposure to the sun, and cancers on the foot usually occur secondary to chemicals, inflammation, irritation, or some other inherited trait. Most of the times, the skin on the feet are overlooked during a routine medical exam and often go undiagnosed when we're talking about skin cancers. Some of the most common types of cancer in the feet are basal cell carcinoma. Basal cell carcinoma is frequently seen on sun-exposed areas of the skin. And because of this, it is less often found on the feet, because remember, the feet don't get a lot of sun exposure compared to the rest of the body. This is also one of the least aggressive cancers in the body. It usually does not spread beyond the skin. These lesions usually appear as pearly white bumps or patches that may ooze or crust and often look like an open sore. In the lower extremities, these often mimic non-cancerous skin tumors or benign lesions. Squamous cell carcinoma is another skin lesion in the foot. This is the most common form of cancer of the feet. When diagnosed early, these lesions are usually confined to the skin and they can easily be taken care of. However, if they become advanced, they become more aggressive and spread to other parts of the body. Lesions usually begin as a small scaly bump or plaque, which may appear inflamed. Oftentimes, patients will complain of recurrent cracking or bleeding, and occasionally it may mimic a plantar wart, a fungal infection, eczema, or an ulcer as well. And sometimes it just looks like other common skin conditions of the foot. Malignant melanoma, this one is one of the deadliest skin cancers known. The sooner it's diagnosed, then the better chance that you have for survival. They are often found on the skin of the feet. Sometimes they may grow underneath a toenail. As the melanoma grows, the more serious the condition becomes. These lesions are often, they have many appearances, therefore they're often called the Great Masquerader. They often start as a small brown or black spot or a lump or a bump. Sometimes they may appear pink or red. They often look like common moles. However, if you closely examine the lesion, you'll notice that they often demonstrate asymmetry, irregular borders. They might have a variation in color and a diameter that's greater than 6 millimeters. They resemble many common findings in the foot, such as benign moles, ingrown toenails, blood blisters, warts, ulcers that could be secondary to poor circulation, foreign bodies even, or a bruise. One of the main things I often tell patients to do is to learn what we call the ABCDs of melanoma. If you have a mole, a lump, a bump, or a patch, then you want to follow the following criteria. And if any of these develop, then you want to see a podiatrist immediately. So when we say asymmetry, if the lesion is divided in half, the sides don't match, then that could be something that's serious. But if the borders look scalloped, uneven, or they have ragged edges. Color is the other ABC. This is a variation in the color distribution, and it varies in distribution. So instead of being completely brown, it might be brown with pink spots or a variation in color. It's not a uniform color. And then diameter is the D. And this is where the lesion is larger than 6 millimeters, or it's larger than a pencil eraser is typically what we look for. Really, the prevention for skin cancers cancers of the foot. Like any cancer, you want to limit sun exposure and apply sunscreen at all times appropriately. You want to make sure that your feet are routinely checked by your primary care doctor as well as by your podiatrist. And as long as we know what looks normal for you, and as long as you know what looks normal for you, then this decreases your risk of it getting worse if you do in fact have a problem. We basically use a simple technique called a skin biopsy. And this is a simple procedure where we take a sample of the skin, and this is done in the office under local anesthesia. We send it to a special laboratory where a skin pathologist will look at it more closely under a microscope and then be able to say if it is in fact cancer or if it's not.